Today we're going to be demonstrating how to collect a urine sample on a male canine patient with the sterile glove method. Before we get started, we want to make sure that we're prepared and we have all the supplies that are needed. You can see here we have a pee pad for our patient, we have Hibitane scrub, we have a urinary catheter in a sterile package, have our syringes that are ready to go, we have a red top tube, sterile red top tube, a set of clippers in case we need it for the prep use, and over here we have a set of sterile gloves and a lab requisition form. We should also have our patient's record. The first thing we want to do is have our patient in lateral recumbency. Of course, if we had a live patient, we would have somebody restraining our patient. I'm going to pre-measure, as we discussed in the previous video, to where my catheter will come out the urethral opening. Before I get my sterile gloves on, I need to open up my catheter. And you want to make sure that the end that you're opening up is the working end or the tip of the catheter. So I'm going to peel back the Sterile pouch. You want to do this very carefully without contaminating the package. So once I have a little fold here, like this, I'm going to hold the paper and I'm going to gently pull back so I have the first part of the catheter exposed. Now what I'm going to do is I'm going to get my sterile lubricant. I'm going to open up the package and I'm going to drop the sterile lube onto the catheter. I will now don my sterile gloves. While I'm doing this, I will ask my holder to extrude the penis. We have an imaginary holder for this video. I'm going to sterilely open my gloves. Now to put our gloves on, I'm going to do my left hand first so I can touch this portion of the glove because it will end up being on the inside of my hand. And I'm going to pick it up, put the glove on. Now I have the glove on my left hand. Because this hand is now sterile, I'm able to touch any part of the right hand glove, so I can fold that back down. And I'm actually going to take my left hand fingers and I'm going to sneak them into the little pocket here on the right-handed glove. Once I have my fingers well in there, I can lift up the glove. So now I can put my right hand into the glove. I am not going to touch the lower part of my arm, I am just going to release. If I need to adjust any fingers, now that I have two sterile hands, I can adjust the glove as needed. You need to be very aware when you have sterile gloves that now you may not touch anything that is not sterile. So I'm going to grab my urinary catheter because this part is still sterile because it's from within the peel pouch. I have it's sitting in the lubricant, and what I'm going to do is I'm going to very carefully, with slow and controlled, I'm going to remove that catheter from its package. Now I don't want any part of the catheter to touch anything and become unsterile. So I'm going to actually take the end and loop it into my fingers so I have a good grasp of it. So I have control of the working end and I am controlling the loop here. I like to pull it a little bit smaller if I can so I don't risk touching anything. Sometimes you can do 2 loops. Now I have my holder extruding the penis. I've asked them to wipe the tip of the penis with the chlorhexidine scrub, so that way I know the penis is clean. Now, my left hand that's holding the catheter is going to be my sterile hand. I will still use my right hand, even though it is gloved, to have control of the penis. But please note that once I touch the penis, my right-handed glove is no longer sterile. I'm going to gently insert the end of the catheter into the urethra, and as I advance, I'm releasing my loop on my patient, ensuring that it doesn't touch any part of my patient or the dog. I may feel some resistance as I get past going through the pelvic canal, and you just give some gentle pressure, gentle but firm pressure to get past there. Once I get to the part where I've pre-measured, I can now release this part of the catheter. I will use my 5 ml syringe to aspirate my discard sample of urine. And then I take my sample syringe, and sterilely put it into the end of the catheter. I aspirate my sample. I remove the catheter from the syringe from the catheter. I will put my syringe back in the package where it's sterile. I can now kink the catheter and use gauze or my glove just gently over the tip of the penis, so when I remove the catheter, I do not have urine splashing myself or my restrainer. I'm going to throw that away, and now I will remove my gloves, make sure that my patient's prepuce is covering the penis. Be nicer in real life. I will now remove the cap from my sterile red top tube. I will insert my sample, replace the cap, and I'll make sure that I write on my sterile red top tube the patient's full name, their entire signalment, the date that it was collected, and the time that it was collected. From there, I will go back to my requisition form, fill out all the required information, patient information, that's the test that's required. Ensure that you check off the appropriate method of collection. So for us, it would be catheter. This will help the pathologist interpret our sample properly, as well as the time that it was collected. From there, we will put the red top tube and the requisition form in a Ziploc bag and keep it in the fridge until it is ready to be sent off to the lab.